Welcome to Muslims and Mental Health with Sister Heather, a groundbreaking program looking at mental health issues through the biopsychosocial spiritual paradigm.
Welcome to another episode of Muslims and Mental Health. Today we're going to be discussing the psychological development in the prenatal period. Development happens quickly during the prenatal period, which is the time between conception and birth. Since antiquity, people have thought that the emotions and experiences of a pregnant woman impinge on her developing fetus. Some of these notions, such as the idea that a severe fright marks a child with a prominent birthmark, no longer persist. However, the premise of the maternal psychological distress has deleterious effects on the fetus is the focus of active scientific inquiry today. A resurgence of interest in the prenatal period as a staging period for later diseases, including psychiatric ones, has been fostered by enormous attention. And I'm really happy today to be joined by Dr. Nadia Jones, who's going to be discussing this with me today. She is core faculty at the Chicago School of Professional Psychology of Southern California. She's also a community mental health clinician specializing in the Latino community, and she also works in private practice around relational issues. So please join me in welcoming Dr. Nadia Jones.
Thank you very much. Very happy to see you. I'm very happy to be here with everybody.
So I just want to jump in right away and ask you how you would characterize the three stages of development: the germinal, the embryonic, and the fetal, and why are these important to our psychological health for the fetus and the mother?
Now, I'm very glad. I have to say, I'm very glad that we're approaching that topic. As you mentioned, one of my main interests, besides being the Latino community, it's mostly relational issues, and I think that every single relational issue starts with pregnancy. That's when you get a new baby, the new little person that is coming into this world and that you're going to foster and help develop, not the mother and child, but like the family in between. And that's when everything else happens. And we're talking about psychological development. And new research, as you say, now is pinpointing more and more how is that psychological mental health development starts there, or can be linked through that area. So then it's very important, and I'm glad that you're bringing up that question so we can start exactly in the little egg. So we have literally, right? We have the germinal stage is the first 2 weeks. So from conception to the first 2 weeks is considered the germinal stage, and then we have the embryonic stage, which is from the conception to the up to 2 months around there. And that is the most important part, which we will dive in, I think, a little bit later. But at that stage is where major organs form, brain development start happening. There are millions of neurons that start connecting within each other on that stage. Everything starts happening very importantly right there in those first 2 months. At the end of the embryonic period, it's when the little embryo is just 1 inch long. And then you start the last prenatal development part, which is the fetal stage, which lasts from 2 months after conception until birth. And, the magic starts happening right there. So you have second and third trimesters right there, and we'll talk about the differences in between. And then the majority of changes are not only brain development, organ development, but maturation more than development, but the size. Baby size, that it starts increasing all of that stages.
And so, I know we're going to get to this a little bit later, exactly looking at depression and the pregnancy, but during those phases as well for the mother, it can be an onset of peripartum, right?
Yeah, and not only that, you mentioned depression, but there is also now like a whole kind of, it's not recognized in the DSM-5 as a disorder, but we have the stress, like it's prenatal stress. There is a whole name for it now, and that the mothers are going through, and it's mostly current mothers, even when it has been related since time of day, we know about the hormonal imbalance in women at that area, which can get linked to depressive symptoms, not necessarily the whole development of depression, but I do have some statistics around that for later on. But it's mostly a huge time of stress, and how the mom is going to be coping in that time, in that delicate time, has a direct link to the baby, because it's always been said, like, calm down because the baby sucks on that, calm down because the baby feels that, like, that's an old tale. However you feel is going to impact the baby. So now science and neuroscience is starting to link in with research and specific data on how is that actually happening or might be happening. So there are some really good studies out there now on that.
And I would think also too, right around this time of the 3 stages, you have, issues with women and their body image and all of those things too.
Yes, absolutely. And how they're feeling, how it impacts their self-esteem, societal pressures of looking good. And now it's everything about nutrition and, healthy weight, healthy gain weight and unhealthy gain weight. There is so much pressure from every single area now. And I think that really impacts the stress that the mom goes through.
So what are some of the adverse factors that can affect the fetal development?
Well, we have, if we go on that one, then we'll link it on the first question on the fetal stage. And that's why that stage is so important. I actually have a whole list for the people that is very research oriented, but we do have, they start with nutrition. Like every time they go to your checkups, your doctor is checking not only your weight, but the baby's weight. They start doing the exams. And it also reminds me of linking to your question, about the stress and depression, how in that stage, in the fetal stage, especially on the last trimester, in developed countries like this one and a whole bunch of countries in Europe, they start doing the non-stress test. That's how they call it now. I know firsthand. I spent my last pregnancy. I learned a lot, and that's why I was very, very excited about this topic. So the non-stress test actually they monitor your signs, your vital signs, and the baby signs at the same time. They put you like for half an hour to an hour connected to the machine, and they check the baby's heart rate, your heart rate, and they see how much stress are you two getting. Not only they measure your liquids and the levels to see what's normal, what's abnormal, but they check how you are doing. And you have people checking in on you on the last trimester, and then when those signs are off, you have to do them more frequently on the last trimester. So they're even doing that now, which
wonderful.
Is incredibly interesting. So that just came out of my memory. I didn't want to forget to say that. One of the main adverse factors, going back to your question, is the use of alcohol and drugs, which is incredibly important. Smoking also. The use of certain prescription or over-the-counter drugs that should not be used. Recreational drugs like cocaine, sedatives, and narcotics. And marijuana has not been, but it is related in some areas. X-rays, that's what they try not to do, X-rays for mom, and other kinds of radiation. Ingested toxins such as lead, especially in low socioeconomical status people and population where the buildings that they might be living in are still exposed to lead. They can have a direct direct impact into the baby. And then illnesses, severe illnesses such as AIDS, cancer, measles, syphilis, cholera, like a whole bunch of list of all that. And stress, like huge, last but not least, is stress.
So let's dig a little deeper into some of those. What are some of the effects that alcohol or drugs would have on a fetus?
Yeah, the most talk about now, and the one that we're doing a lot of conscientiation, and that's where the doctors are monitoring your drinking, is fetal alcohol syndrome. Mostly because it's so preventable. They, it's. I love that this is a cultural show, because depending on which country you're from, alcohol is viewed in different ways. And the sad thing with fetal alcohol syndrome is that it's not about necessarily how much alcohol a mother consumes. It's absolutely unknown. They do. I shouldn't say that. They do know that heavily drinking parents or just heavily drinking moms, those children have a very high risk of developing alcohol fetal syndrome. But the problem is that what they do not know is that when a mom is drinking, like the socially accepted, they always say you can have a glass of wine from time to time. My both pregnancies, I even have had a couple of glasses of wine throughout, but it was always on the back of my mind, should I, shouldn't I? Like maybe just a little sip, maybe I just should abstain. And they would say, just abstain. Because sadly, it's not known when or in which trimester it will actually impact the baby, the fetus. Like they really don't know, but they can recognize it only when the baby's out. So that's why they're making such a big emphasis on just don't drink. If you're pregnant, just don't drink. Drink later. like if you're breastfeeding or not, you will have certain things, but it's just 9 months of your life. You really wanted this baby, hopefully, so then mostly abstain. And if people is going to be drinking, then they really need to know what they might be facing. So, okay, you can say, okay, a little sip here and there, but it is your own conscious decision to do it or not to do it. I would say, I talk to doctors. I have my aunt's a pediatrician, and I have had a glass of wine. My baby's fine. But I can't say, if I were unlucky enough that maybe that amount of alcohol was needed for my baby to develop a risk, I don't know how worth it is, because that one is a no. What we do know, again, for sure, is that heavily drinking, and then we go back to stress. So if we start talking about the environmental stressors or family stressors or whichever stressors are happening out there, then there is a direct link between stress and alcohol consumption or stress and drug consumption. So then we do know that a mom that is highly stressed and is used to, prior to their pregnancy, to cope with alcohol use or substance abuse, chances are she's not just going to withdraw for 9 months.
Right.
So if there still is, if she doesn't have support and she still hasn't learned to cope with stress, if she doesn't have the proper services and she's still dealing with her stress or with her adverse factors through alcohol, chances are that that baby might develop alcohol fetal syndrome. And this is something that it cannot be taken lightly. I think that what is more sad, and even I have a dissertation student now that is doing her whole research on alcohol fetal syndrome, because she works for an agency that works with this, and they don't know. They don't know they don't know how the teachers in the community identify this disorder. Mental health professionals sadly are not. They're aware of it, but they don't dig in as deep into it and how important it is. It can lead to misdiagnoses. Because there is a lot of comorbidity with hyperactivity, ADHD, especially mental retardation. There is a slow motor development. There is a lot of irritability on the baby, incredible lack of attention. So they sometimes are just being seen as ADHD children. They might be also misled to be understood as children that are dealing in the autism spectrum, and they're just misdiagnosed because they have alcohol fetal syndrome. So if they diagnose them properly, then the treatment will be different. So it's so important to know and to ask in a good intake interview to the mom, how much did they drink during their pregnancy? Many of them are ashamed to tell you.
Right.
So it helps sometimes that usually, I'm sorry.
It raises the question for me as well as you're talking about this. It just makes me wonder if somebody has been drinking steadily and they stop for the pregnancy, if just the withdrawal of the stopping would also affect,
Yeah. And again, in that case, we will need to ask, when did they stop? Because let's say I have had clients that told me, I was drinking normally socially, and then 2 months later I found out I'm pregnant, and now I'm freaked out. I'm like, well, let's wait and see what happens. So then, are you going to abstain from now on? Like, did you continue drinking? Like, how heavily were they drinking? Is usually my question, because you do want to see, okay, I went to 2 weddings and I drank a glass of wine. Okay, let's just check how the development of the baby is going, all the ultrasounds and everything, and then we will look at the baby when it comes out. Now, if I have a mom that tells me I was drinking 5 times a week, 2 bottles of wine, or like 6 packs of beer, or like straight up vodka, very different answers.
Right. I can see why you really need the exact number of like what they're talking about, because it's all relative.
Correct.
Yes.
Yeah, it really depends. But there are physical attributions to alcohol fetal syndrome that the doctor and the mental health clinicians can use to check, and people can go online to see the pictures of babies to see how they look, because it's harder to describe. But they usually do have like a small head. There is a smooth ridge in between the upper lip, so they don't have this that we have here. Their eyes are closer together. So all these things are very important. The babies are usually born with below average height and weight. They develop differently. Again, you can start the hyperactivity and the lack of focus. So like if you have a child that is ADHD, you early on diagnose, you also might want to look at the physical structure of the child to see if it matches the interventions or the interviews, kind of.
Okay.
Interesting, huh?
It's very interesting. Yeah. And, but I also, another question came to my mind as you were talking.
Yeah, because you can have a whole hour on this.
Which is for people, back to the drugs, but not maybe illicit drugs, but let's say somebody is bipolar or, I don't know, they have a disorder which they take medication for regularly. Will this affect the pregnancy? Will they have to stop their medication during the pregnancy? How does that work?
That is a very interesting question. My specialty is not psychotropic medication, so that is not my compliance. So I do have to state that I am not a psychiatrist or a medical doctor. I am the other kind of doctor, but you always consult, no? And there are certain things, data oriented, that we do know. So I can say that there have been now certain medications that are considered safe to take within pregnancies, as long as you are constantly monitoring how it's impacting the fetus. There might be some side effects. Hopefully, most of them are minor. However, there are other medications for bipolar disorders that are extremely heavy on side effects, and they should not be used during pregnancy. So it's incredibly important that when a woman gets pregnant and it is taking any kind of medications, even vitamins, any kind of medications, you have to consult with your doctor, because then your doctor and your psychiatrist hopefully will be in collaboration talking about this, and then they can actually provide psychoeducation and tell you which medications are safer to use and which medications are not safe to use during the stage of your pregnancy, or like if the dosage needs to be adjusted, or which ones can do. I have had mothers that tell me, okay, I'm reducing my medication, however, I am taking all these other natural things. I came to discover very, very recently through my own doctors, through my own pregnancy, that certain herbs should not be used during pregnancy, which I didn't know. I remember getting sick and I was drinking natural cough syrup because it was natural. Like it's supposed to be good for you. It's supposed to be healthy. And I was taking the arrowroot black honey. And my doctor told me to stop that right away.
Oh, okay.
No, she says, like that can be a small doses might be dangerous to the baby. So like, so the fact that it's natural, you should not be making these decisions without consulting with your doctors.
Yeah, and I know like in the Muslim community, a lot of people are into homeopathic remedies. So that's really good to know.
Yeah. And it's great. I mean, she gave me other alternatives and she sent me to talk to someone, so to see like, what can I do? Because I couldn't take the regular medication either. But there are certain things that you can do and that you cannot do that might harm your baby. So you want to, because we do need to remember that they feed from us. So whatever they ingest as well. So the fact that it says natural or that it's made by herbs, it doesn't mean that it's not harmful for the child. It might be okay for us, but not for the child while it's developing. So you can take it again later, but you need to consult to see if these ingredients are okay or not. So in natural or in psychotropic medication, both ways.
Great. Okay, so we did already talk a little bit about fetal alcohol syndrome, so I want to move into talking about depression proper and what it looks like in pregnancy.
Yeah, you have so many great questions. Hopefully we won't derail as much, right? Especially knowing you and I. Depression is an area that to me is fascinating. And I have to say, especially in pregnancy, because when a woman goes through pregnancy, as we mentioned before, the hormonal imbalances are so up and down all over the place. You're learning to adjust to the new life growing in you. Your body's learning to adjust to the new life growing in you. The hormones really, they go berserk. Especially the day you give birth, they go to their higher and the lowest point ever, which is like almost, it's insane, like when you read the numbers. Some of the symptoms that are associated with depression, there are some statistics that show that even 70% of women might go through either one or other symptom of depression, but it not necessarily will give a full-blown diagnostic of depression. However, 10 to 15% of women might go into full blow. So it is that important. Yeah. Now, people might be wondering, well, what do we look for, right? So we're talking about, and also it's important now, most women, when they're pregnant, in their in the doctor's office, now you're filling questionnaires. And a lot of them are depressive scales to see how you're doing with your mood. So they're now incorporating that into a regular checkup. Not everybody, like my first doctor and my second doctor assessed things very differently. In the second one, I could tell clearly that they were assessing for depression. My first one will ask me from time to time, but this one, every time for the checkup, you have to go through a questionnaire. So they ask about, in the last 7 days, are you going through this? So I knew that it was a depression inventory. So that's important.
I actually had a recent conversation with a physician at USC who she's in women's health, and they just recently are hiring a social worker to come on board because they find that 80% of the women who come through women's health have some kind of mental health issue.
And look, and your number is even higher than my number. I have 70, you have 80.
And that's so they want to do inventories. They want to assess because they maybe shouldn't be seeing a physician. They need to see somebody in mental health.
Yes, and sometimes they need to see both. So it's like they will, like if you're seeing the physician and they're nurses, because it's not even them. Like the nurse that reads the first one is identifying this. Hopefully they're properly trained. So then they need to refer you to the social worker or to the therapist in the clinic or hospital that they're going through, receive their checkups. So usually the things that they look for is like a sense of that nothing feels enjoyable anymore. Like everything starts, it's not fun. Like things are not fun anymore for you. You're incredibly tired, which is interesting because like you being pregnant are tired.
Right.
And it's very different. First trimester, you go through all the hormonal imbalance, right? So it's like, it's horrible. You go through all the nauseas, you go through, throwing up. Remember that?
Yes,
it was so much fun. All the nauseas that goes in between, like you're feeling weird. You're like adjusting to like, you like wanting to blow into people because you go through mood swings. You seem a little bipolar.
So it would be hard to parse out.
Yeah.
Like, was this normal because I'm supposed to be going through these hormonal changes, or is it something else?
And that's the trick question. That's the $1 million question. That's where assessment comes forward, and they check the duration. Is it happening most of the day, every day during 7 days?
Oh, the DSM.
Yay, my best friend. Or is it happening from time to time, leading you to think that it is an emotional imbalance? Like, am I like looking like this, but then I see you and I get super happy, and then we can have a lunch and I'm fine, and then I'm enjoying my day again, and then it's just when I'm lonely again, my hormones start taking over. Is it through the whole pregnancy? Is it more than 1 week at a time? The duration and the onset is so important to assess for us in mental health, and hopefully for them as well. Because sometimes it's even easier, like when we're working with pregnant women and they are going through their checkups, but they also have a therapist, so you can double check that even then. So it's that, and then in the second trimester they call it the best one because your hormones are settling a little bit better. You are settling with your body. You still don't look fat, right? So you have your energy comes back. Hopefully you stop puking. Hopefully not every woman that I talk to though feels that way at that stage.
No, I had I had it for 9 months.
See, I have a friend that had it for the whole 9 months too. She was hooked up to machines so I'm saying you have to take every case individually, right? Yeah. So hopefully for most women, they will have this wonderful 3 months in the middle.
Right.
And then you have the other 3 months when your baby is huge and you are huge and things happen. You can't move as fast anymore. I have the woman, the typical, like, I can't touch my feet anymore, So they cry because they can't touch their feet, and everything that the partner tells them trigger them. They are so sensitive, but they're not depressed. They're hormonal. They're pregnant. Right. So it's so important to assess properly and to provide psychoeducation, not only to them, but to their partners. I always go back to the relationship issue, like to their partners, how important it is for them to know that they're going through this and to identify, is this going overboard?
And be supportive as well.
Exactly. Yeah. So then we're looking for all of these, the irritability, the trouble sleeping, all those kinds of things, like the fatigue, the desire, the one that, like if there is a pregnant woman or any woman that has a desire to end their life and that they don't care about their baby anymore, that is, that is what? That is more likely than not depression. Right. Like when you get to the point where you just want to end it all, that's when they definitely need attention. Right. So that one is one that I will never take. I shouldn't use absolutes, I know, but very unlikely that I will take just as like, oh, you want to end it all? Okay, I'm not going to check in with you again or whatever. No, that's one of the main indicators. So you want to check on that one. But yeah, like it's very important now how you want to make sure that these women are properly assessed and properly helped. And I'm glad that, USC is doing this one. UCL in Irvine is actually doing a lot of studies on this as well, close by. And one of the things that this is related to one of the other questions that you have on stress and the impact of the psychological health, but I put it in this way because it was important. They were studying depressed women and their babies before and after for a long period of time. And what they found, which surprised them, is that what was important is the consistency. So if you were not depressed before birth and you were not depressed after birth, your baby usually will develop better, physically and psychologically, and they will measure that through like how the baby will latch, how the relationship between the mom and baby. The interesting part is that if you were depressed before, during pregnancy, the depression was addressed and you had enough services and whatever the support from everybody, so your depression can be as controlled as it was before instead of spiraling up or down. And you were depressed afterwards, having postpartum depression, the baby can still develop properly.
Oh, okay.
That was fascinating for me
great.
to read. Yeah. So what was important to them was the consistency, that the fetus inside of us will not be as impacted by the fact that a woman has depression, by the fact that a woman has a mental illness, by the fact of how stress is out there. But, and most importantly, how is it dealt with through your pregnancy? And that is something that I really wanted to emphasize on this. So I'm jumping to your last question, and how important it is for us to provide these women with proper services.
Right.
Because if it's early identified, or if we know that there is a prior condition, we can really provide the help they need so that fetus is not as impacted. So if the woman becomes conscious of it and really loves their baby and wants the best for their baby, we hope that they are going to get enough help so that they can be dealing with the depression better through that stage, so the baby is not as impacted by the up and lows, up and lows, up and lows. So it's basically the transition what impacts the baby. Isn't that fascinating?
That's great. And I'm glad they're doing that research, because this is one of the other hurdles, right? Is having the research then can make the case for, because one of the reasons that we haven't seen more like what USC is doing, we're having the social worker come in or a mental health professional, is because insurance won't cover it.
No, they won't pay for it.
And so, to have that research to back in, then hopefully our politicians will see a need to change things so that it is covered.
Yeah.
Is really, really important.
Yeah.
Because if people have to pay out of pocket, a lot of people can't afford to do that, and so they will see it as a lesser priority, and they won't get the help they need.
Absolutely. And I'm not gonna get like extremely political, but you brought it up, so I'll just second, and I promise that I will let it go. But if politicians will really see that need, they will also see the benefits of having places like Planned Parenthood for these people. We're not talking about abortion, we're not talking necessarily about anything like that, but places like Planned Parenthood also provide free services for these women. They do provide the checkup for women that are pregnant and they cannot afford it. And they will provide services for them through their counseling centers. So that is something that they are not even talking about on TV. They're just talking about like, the abortion, but they forget about all the other wonderful things that they do. And there are places like that, free community clinics that are doing all this, to provide these kinds of help. Like Kaiser now does a good job out of it. I mean, it's growing better and better, but not everyone has insurance to go through these services. So the other people needs places to go, and people like you and I will also have to make a living so we can help everybody. Right. So it's interesting. So I'm glad that you brought it up. I promise I will shut up on that one.
Because even with Obamacare, it doesn't mean that the benefits will be enough to provide benefit for that.
Correct. Yeah. Or that it will cover the whole package.
Right.
And as we know, like I work in community mental health, and I always tell my students at the university and the people that I'm working directly with, which is the low SES, my children are not going to be able to have those services because I can't afford it. So take advantage of it. If it is being given to you, take advantage of it. It's not going to be the same as equal for everybody. So it's great that we have places to go to.
Well, I have a few more questions I want to ask you, but at this point, we need to take a short break for our sponsor, and we'll be right back.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
Welcome back to Muslims and Mental Health. Today we are discussing the psychological development in the prenatal period with Dr. Nadia Jones. We're going to continue our conversation, and we're going to look at how stress affects the mother and child.
Yeah, we touch a little bit upon it. And one of the things that are important to know, not necessarily that everyone is going to remember, but the first 2 trimesters are very important when dealing with stress for the mother and the child. In the last one, they're doing all the measures that I mentioned to you about, but that's because they already determined how the stress was impacting them in the beginning. Week 10, the embryo becomes a fetus. That's the second stage that we talked about. During that time, the brain will produce almost 250,000 new neurons every minute.
Wow.
Isn't that cool? But if you think about it, that's how important it is that you're dealing with stress.
Right.
So that they can produce all that healthily in a good environment. Like when we talk about everything being a nice, safe environment, it's all the time. So I think that even that knowledge that a woman now can have puts even more stress to them. It's ironic enough. Yeah. And then during weeks 24 and 30, the nerve cell connections are reoccurring. They go back and forth, like all the chemical synapses. And then that is when current research is going to say that the child in those weeks start not only feeling you but hearing you. They start sensing the outside. There is a lot of research dated even 20 years ago, and now they're getting much faster on how, they will tell you, talk to your baby, put music to your baby, put light to your baby. But it's not only about that. The way that you talk to your baby can determine how much the baby is going to be able to tolerate anxiety.
Well, that absolutely makes sense to me, right? Because as you were talking about the brain development, how many neurons are developing per minute, we know that talk therapy can rewire the neural firing, right? So it makes absolute sense.
Yeah. That's in neuroscience, in NeuroLinguistic Programming. Did I say it correctly? Because in Spanish I can say it, in English I cannot say it as well. So I have to repeat it. You basically do talk therapy, but next to the neuroscience concepts. So if you can help an adult to rewire their brain by putting messages through stories, right, in an LP, of course that it will make sense that happens in pregnancy when the baby can hear you. Right. So you have Julie Gottman. Do you know the Gottmans? The Gottmans are this awesome Jewish couple who has done so much research in Seattle in their institute on couples. And Julie Gottman, the wife, she's very interested in pregnant ladies. And they have a book called And Baby Makes Three, and how the personality of the baby can be directly linked to how the couple argues during pregnancy.
Wow.
So we're not saying that couples should not fight. Go ahead, fight. But it's about how they fight and what are they telling to each other, and how is the mom dealing with that, that it might impact the baby. So again, we go back to stress. If there is marital discord, which, huge other topic on its own, how the the husband or the partner, I should say, treats the pregnant woman in that trimester and understands the hormonal imbalance and all these kinds of issues that they go through. You mentioned self-esteem.
Right.
You mentioned body issues, body weight.
Right.
If you're talking about it,
in October also we cover domestic violence.
Domestic violence issues. So if you go through all that and you put them all together for a variety of myriad of things that might impact pregnancy, and you have a very understanding partner, we will hope for a healthy baby.
Right.
But all the pressure on that mom that is not hoping to continue to have a healthy mental health, but also to transmit one to the baby, they're not superhumans.
Right.
They might break down at some point. So someone else has to help them and take responsibility for all this and provide that holding environment so that she can do that. Another thing that is very interesting now that happens on that is not only the maternal stress on that side, but also how many women now work so much until almost their last days of pregnancies. In the past, it wasn't like that.
Right.
So there are studies now that just compare, and many women say, oh, I'm going to be bored if I don't do this. Or I'm going to be bored. Well, you're supposed to start to establish a relationship with your child. You're supposed to relax so that your child can grow. Like on those last weeks, the baby grows a lot. They need to be okay for them to be able to grow. We'll get bored for a couple of weeks. But
And
they
for so many
can't with
reasons,
money,
you need
financial.
rest,
Yeah.
because you won't have sleep after it comes.
Yeah, and that also goes to how are you going to be able to cope when they're born. So there's so many things that is so important, to provide psychoeducation to these mommies and like how it can impact them later on. And sadly, in the United States, I'm sorry, we're going back to politics. We have a horrible, horrible maternity leave policy. So if you're not on a company that's going to support that, then women tell me I have to work. It's like, it's not that I can't. I have to work to be able to make my ends meet. My company is not letting me leave even when the doctor has written me the authorization. They tell me that they'll replace me. I'm like, oh, but that's illegal. So we start talking, and all these things have a huge impact on their babies.
Right.
So there is so much regarding stress and how it can impact not only the mother and child, but the psychological well-being of that child.
And how many women, I'm sure you've come across it as well, because I have, that after they have the child, even their whole thinking about having children changes in the sense that, wow, actually I want to stay home now. I don't want to go back to work because I was thinking I would, have the child and go back to work. But then once the child is there, wow, I don't want to leave them, and I want to be at home.
Yeah, attachment, and like they want to be the ones providing the care for the baby, and if financially they can, then wonderful. But if they can't, you only have 4 to 6 weeks,
right,
to go back to work. 6 to 8 weeks to go back to work, and that's it. So that is such a huge influence on how women are dealing now with not only bonding with their child while in uterus, but also out. Once that they have them, and there are now studies going into trying to support this data towards postpartum depression. Because if you have that kind of condition, then also how is that impacting the mental health development of your baby, unborn and born, both ways?
Which I think often gets neglected, the point of postpartum, that it can happen within the first 2 years after. I mean, I think people expect it immediately, but they don't expect that it could be up to 2 years.
Yeah, especially if we're talking in like, highly educated woman. Highly educated woman is another one that is being looked at now because if they have a super successful career, it's not like they're necessarily, they are in a place where maybe financially they can leave it. However, also because their career is so successful, they're expected back.
Right.
It's you can leave, but you know that you can't leave.
Right.
So they have to come back, and then they go into a modus operandi where like, okay, yes, especially if they want to breastfeed. So they're breastfeeding, so they're pumping, right? They're pumping, and it goes, go, until you break down.
Right.
And then you realize of all you're missing, and then you go into depression right there. That is still postpartum because it is after your partum, and it is strictly related to your baby's birth, or it can also be an adjustment disorder at that point, but that is also about knowing how to diagnose properly, because you just said the key. The time is so interesting, but the onset to me is more. and the duration. Because if you were going, it's like grieving. You're going, go until you get the time to process what happened. It triggers you. It's stressful. It's a stress-related disorder. And then boom, you break down. And if you can't care for your child, it's going to continue to impact that. So again, we talk about, if we link back to what we were talking, bridging what we were talking before, it goes again into these transitions. There is no consistency. So if there is no consistency, it's going to impact the child or the fetus.
Yes. Okay, well, so from that to one more heavy question, which is
Like we didn't cover it enough.
Can mental illness develop in the womb?
Yeah, I think it all gets linked to that, right? So we can actually do a little summary and then wrap it up. I absolutely think so. The more I read about this, the more research is coming out. It's leading us to support that. I mean, the evidence is leading us to support the hypothesis that yes, it will.
And it all
good
seems
mental
to be
health, good baby
linked
mental
back
health.
to stress as the biggest thing.
Yeah.
And people are so commonplace these days say I'm stressed out, not really attaching real meaning to that word.
Correct.
Because stress is like what holds a building together. It's actually not something we experience. We just, turn that into colloquial, but it's something else actually that we're experiencing. And, people dismiss it. Because,
very much so.
Everybody's stressed out.
They really don't know how to cope. They cope with other unhealthy things or healthy things, or they might deflect it. They might absolutely deflect it. They might say like, I'm not stressed. I can deal with it. I just, I keep functioning.
Right.
I still have this. I still have that. But you're just like, it's like you're just putting Band-Aids and it follows you and it's going to come and bite you. And then you'll break down because you really don't know how to cope with stress because you're just pushing it away.
It's the death of 1,000 cuts.
Yeah. It's horrible.
Yeah.
So yeah, I will dare to say then yes.
And then is there anything else you would like to add about the psychological health of the mother during the prenatal stage?
I really think that one of the most important things that the pregnant woman should know is to ask for help. I think it's so important. You especially coming from the Latin culture when we, have the Marianismo and all these kinds of good things. And like we are to take it all and we are to do it all. And, everyone else can fall apart, but we can't fall apart. If you don't take the advantage to fall apart when you're pregnant and say, okay, you now have to help me because I'm pregnant. I want to be okay so that I can help this baby develop okay. Then it's like, when are you going to ask for help?
Right.
So, and I always go back to the relational issues. Like if the people that you are surrounding yourself with, especially your partner, covering the domestic violence month that just passed through, to your family, to your friends, to your whole network, if they cannot provide you with that emotional holding environment, then you cannot going to be able to provide it for your baby. So enjoy that relationship with your child by asking them to allow you to do so. And take the time to talk to your child, to and if you're feeling like you can't, or if you're thinking that you can't do that, ask for help. If no one else is identifying it, I think that's why programs like this are so wonderful. If we're trying to educate you, but you're like in an abusive partnership or whichever other thing, learn as you're pregnant, because now it's not only your life, it's the life of your baby. And then after that, you can identify things and you can go to a place where you can say, yes, I think I am dealing with issues right now. I think I do need help because I can't cope properly for my baby. And then you hopefully will get the help so that you can.
And I really like the relational frame because of all times, this is the time to really get on board with your relationships because you are multiplying.
Yeah.
You are adding to your family, and that means the relationships are going to change. So better now to learn how to deal with relationships and have healthy ones than to wait until you have more people and not really know how to make those work.
And you're triple stressed.
Right. Exactly.
Everything goes back.
So I really appreciate you coming on with us today.
You're
It's
welcome.
been very helpful. I think people are going to learn quite a bit out of this episode. I hope we can have you back again sometime. I want to transition to our fun questions that we like to ask all our
fun
interviewers.
questions.
And so the first one is, who is your hero if you have one, and why?
My mom.
Oh, that's great.
My mom and single mothers. I have my mom just because from her, I've learned a lot on things that I want to do and things that I don't want to do, both ways. I think we keep talking about this with her, my sister, and my brother. But she's an amazing spirit. So it's really cool. And then it will be single mothers because I have a husband and I have 2 children of my own. And you learn so much as you go. And then I see these women that are so amazing and they're dealing with it all by themselves. Or that they might have a partner, but that goes away for long periods of time and they feel like single mothers. And I just don't know how they do it. It is so empowering to me to see them and to have a chance to work with them and give back to them so that I can learn from them. I have a huge amount of respect for single women. Yeah.
Me too. Okay, and what is your favorite concept and why?
Perception. It has become, after all these years, I think it's all about perception to me. That's the only part of a theoretical concept in psychology that's cognitive behavior, another thing. But I have learned that everything is about perception. You can have one situation, people can perceive it in different ways. I like to take the positive perception. I'm always working towards that. Not to deny the negatives, but just to learn that my life is better if I live learning how to focus on the positives, dealing with the negatives, instead of just making it negatives.
Right.
Or unhelpful, however you want to call it. So to me, it's all about perception. You have the same situation, and you can take it as you can perceive it as you want. It's going to impact everything in your life. So to me, a positive perception is better than anything else lately.
Cool. And then what is your favorite word and why?
You said to keep it clean.
Yeah,
yes. I wonder why. It would be patience. Yeah? Okay, good. I thought it was just for me. No, I'm just kidding. It's patience.
Oh, that's a lovely word.
Lately. Again, 2 kids, a husband, a house, a career. It's patience. You just have to learn. I think patience and perception would be linked so much for me. But it is all about patience and I'll have to say patience and a good sense of humor. If you just take those words and those concepts, at the same time, it's what I'm telling myself over and over. Patience, just breathe in patience and move on. Breathe in patience and move on. Deal with stress, right?
Yeah,
with
exactly.
patience.
Sounds wonderful. Well, thank you again.
You're very welcome.
This is going to conclude another episode of Muslims and Mental Health. We're so happy to have your feedback, your comments, your concerns at nafshealertherapy@gmail.com. That's NAFSHEALER therapy@gmail.com. And please visit our adjunctive website at nafshealertherapy.wordpress.com for other resources and links. Thank you.